All right, so again, we're in a very entomologist dream kind of situation. Not a lot of disease here, not a lot of leaves in either of these tunnels to have a lot of disease, but in general, so in a high tunnel, again, I talked about this earlier, humidity is the driving force of a lot of the problems inside a tunnel. So we're not getting rain, of course, but we are getting the humidity. And right now, this tunnel is about 75 or 80% humidity, which is very high. So we have the sides up and the end walls, these have doors and those are always open. We know that here in Kentucky, at least, that a lot of our growers, maybe their sidewalls don't come up or they don't come up this high, or their end walls may open completely or only the size of the door. So all of that air exchange is really going to affect humidity. So any disease on the upper parts of the plants are going to be driven by leaf moisture. For those of you who know me, I use the word free water. Free water can be overhead irrigation or rain or humidity. So that's where free water comes in. So humidity is what we talk so much about in high tunnels. Some of the big diseases in high tunnel tomatoes are your bacterial pathogens. We start managing bacterial pathogens right when we plant, and we are using rotations mostly of coppers. There are a couple of other products like Actiguard that are also effective against bacterial diseases. Leaf mold, we'll start seeing leaf mold in July when temperatures heat up. Leaf mold likes relative humidity above 80%. So once we start seeing that very high humidity, we'll start seeing leaf mold. Leaf mold is pretty easy to manage if it's managed preventatively. And again, as long as that humidity is down. So every high tunnel, and at least in here, one humidity meter, like the larger tunnels we were just in, at least two. So growers should always know what their humidity is. Agents, if you contact me, I'm going to ask that question. Any of our management, again, Dr. Besson said earlier today, any fungicides we use, any pesticide we use in high tunnels must be approved for greenhouse use. So in ID 36, our Kentucky Vegetable Management Guide, and in the SEVU Guide, that's a Southeast Vegetable Workers Working Group, in that guide, similar information, different formats, but in both of those, there are greenhouse product guides. And if you have any questions about that, please ask. So you can't just use those standard tables to determine what to use in high tunnels. You must use those greenhouse approved products. Okay, so then besides your foliar, fruit, stem, above ground diseases, you've always got those soil-borne diseases. Here in a high tunnel is not a greenhouse in terms of production. So we use the word greenhouse when we talk about pest management and EPA approved products. But when we talk about disease management and production, we're talking a high tunnel, you're planting in the ground. And because we're planting in the ground, we have to be concerned about soil-borne pathogens. Sclerotinia diseases, we talked about sclerotinia earlier. We talked a lot about sclerotinia today. So timber rot is the tomato version, the tomato disease caused by sclerotinia. We did have a little bit of timber rot here when we first planted. It's gone. It's too hot in here. Again, sclerotinia is a spring disease. Southern blight is another one. Southern blight is not related to timber rot. So one's previously named Sclerotium rolfsii. It produces a structure called sclerotia. That's that survival structure. Sclerotinia also produced sclerotia, a survival structure that lasts many years in the soil, but those two fungi are not related. But southern blight, what we call Sclerotium rolfsii, now it has been renamed Athelia rolfsii. Either way, southern blight is also caused by a soil-borne pathogen that can survive many years in the soil. So really think about rotations. When we talk about rotations in disease management terms, rotating out of a susceptible crop. So diagnostics is absolutely critical. Rotations. So think about soil-borne pathogens, think about nematodes, think about managing your environment inside the tunnel, and always have some type of preventative program, because once disease hits, we can really lose a lot of plants. So that's kind of my sum up.